Good afternoon, and welcome to the National Cancer Institute's Facebook Live event. My name is Cindy Lawler, and I'll be your host. I work in the NCI Communications Office, and today we'll be talking about a very special resource we offer, the NCI Contact Center, and how the center staff answers questions about cancer and clinical trials. I also want to mention here that we'll be covering the same topic in Spanish on Wednesday, November 29th at 1 p.m. Eastern Time. So be sure to check NCI's Spanish Facebook page for details about that. A little background for those of you who don't know, the NCI Contact Center is a federally funded cancer education program created in 1975 as an essential part of NCI's mission. Anyone can contact the center's information specialists for scientifically accurate, up-to-date, and easy-to-understand information on a range of cancer topics, including clinical trials and the most recent treatment advances. And we offer this, the service in both Spanish and English. And I'm pleased to be joined today by Astrid Helgeson, who's the supervisor of the NCI Contact Center. Hi, Astrid.
Hi, Cindy. Hi, everyone.
Astrid, why don't you just tell us a little bit about your background and your work there at the center?
Sure. So my name's Astrid Helgeson. I've been at the Contact Center for over 10 years, and I'm very excited to be here today talking about the Contact Center. It's an incredible free service for cancer patients, their loved ones, as well as health professionals and cancer researchers. And everyone here is so dedicated to providing the highest quality of service to those who contact us. And they also are delivering this information with a lot of care and compassion. So it's a very unique service, and we're all very proud of the work that we do. And in my role, I work with communication training of contact center staff. I help give guidance and supervision to information specialists, and also help with quality assurance efforts of the calls and emails and live help that the information specialists respond to.
Okay, great. And we'll learn more about those things as we go along here. But at the moment, I just want to tell those of you who are watching that we do invite your on-topic questions during the event. And as you have those questions, please ask them in the comments section, and we'll try to answer them as time permits toward the end of the event. But now back to Astrid. Astrid, why don't you talk a little bit about the role of the Contact Center and its connection to the National Cancer Institute?
Yeah, absolutely. I'd be glad to. So the National Cancer Institute's Contact Center is part of the National Cancer Institute's mission to disseminate reliable cancer information to the public. So we primarily use NCI's resources, and these resources are carefully maintained to be up-to-date and scientifically accurate, and they're available in both English and Spanish. But we have a lot more to offer in addition to cancer information. We help people who are looking for financial assistance. We also, if people are looking for support, help with coping. We have a database of support organizations that we refer to as well. And then we also have a smoking quit line that provides smoking cessation counseling for people who'd like to quit, as well as helping people who are looking for clinical trials, and that includes both cancer patients and their loved ones, and then also health professionals as well.
That's quite a range of services and support there. What are the different ways people can reach you, and when can they reach you?
Sure. So we have a lot of different ways that people can reach the Contact Center. You can call us at 1-800-4-CANCER or 1-800-422-6237, and you can also reach us by live help, so like an online instant messaging, and those are both available 9 a.m. to 9 p.m. Eastern Time in English and Spanish. If you visit cancer.gov, you can see at the top of the screen, you can click on 1-800-4-CANCER, and that will also direct you to how to send us an email as well. And in addition to these things, there's also social media. So NCI has a Facebook page where people can submit questions, as well as they are on Twitter and Instagram. So we have a lot of ways for people to reach the Contact Center with their questions.
We're trying to make you guys available to anyone, almost anywhere.
Exactly. Absolutely.
That's great.
Yeah.
I know there's a wide variety of people who call into the contact center. Why don't you tell me a little bit about that?
Sure. I think that there is definitely a wide variety of people who reach us, and I think it's important to know that the people here are very used to answering a wide variety of questions. So whether it's someone who's just been diagnosed and they want to learn more information about their cancer or their treatment options, or perhaps it's someone with advanced cancer or a family member with advanced cancer who's just looking for support and some more information about the options at that time of life. So we have resources that span those topics as well as the more detailed questions that we can get from healthcare providers. So we do have physicians call and cancer researchers who are asking detailed questions about medical research, and we have a variety of resources to address that too. So there's really no question, too big or too small. We're happy to help people with all of those different things, and I think the information specialists here are very uniquely skilled because they can help with those more complex questions, and then they also can lend an empathetic ear to the difficulties that can come with a cancer diagnosis.
Yeah, I know that I called the contact center myself when my mom was diagnosed with ovarian cancer. Even though I'm in the cancer communications field, when it came to a personal experience with cancer, my family and I really benefited from the expertise and the kindness that the contact center staff has to help us understand all the options for Mom. Your emotions are really kind of running all over the place when you're in the middle of it. It made a difference.
Mm-hmm. Oh, I'm so glad.
Yeah. If you're just joining in, I want to welcome you to the National Cancer Institute's Facebook Live event about how the NCI Contact Center answers your questions about cancer and clinical trials. If you have questions for our speaker today, please feel free to ask them in the comments section of the video, and we'll do our best to answer them during the event. But meanwhile, back to Astrid. Tell me a little bit more about what it takes to be an information specialist, the training involved.
Sure. So to be an information specialist, we have a very special group of people here at the contact center. They come from a variety of backgrounds, such as social work, but they all, I think, are found to be caring and kind and compassionate, and that's something that we look for during the interview process. It's not only those skills, but also the ability to both understand and communicate all different types of medical information. When they're hired, they go through an extensive several-week training process, not only about cancer biology, cancer treatment, but also about the psychological effects of cancer. And I think many people here, including myself, and like you mentioned, Cindy, have been touched firsthand by a family member or loved one who has had cancer. And I think that helps provide an environment where all of us are here with that same goal of helping people to the best of our ability through what can be a very difficult and stressful time. So it creates a very unique environment, and I think it's one where there's a lot of effort being given to helping each person the best that we can.
That's right. And in fact, why don't you talk about some of the common questions that you get about clinical trials, for example, and how your specialists would address those questions?
Sure. So we get a lot of questions about clinical trials, and our information specialists are used to handling, again, a wide variety of questions. And some of the most common questions can include maybe a cancer patient who is looking for treatment options and perhaps has been given a treatment plan by their physician but wants to know what else is out there, what's being researched in their area. Another type of question that can come up about trials is perhaps someone who has a more advanced cancer and their cancer is no longer responding to treatment, and their doctor may advise them that clinical trials is the next step that they can consider. So we can help walk people through that process, and we help conduct clinical trial searches, and we ask a series of questions to help people understand what the trials are, what their options are in their area. So our information specialists are excellent listeners and really pay close attention to where the cancer patient is at, what sort of questions they have about trials, and are there to help them through that process. And then also we get calls from health professionals as well who are maybe looking for a trial for their patient. And so that's something that we are adept at helping people with as well.
That's great. I know that sometimes people have questions about the financial side of trials. Can you talk a little bit about that?
Yeah. Absolutely. We have resources from the National Cancer Institute that discuss the financial costs that can come with clinical trials. So we do get questions perhaps about like what Medicare may cover, or just how the costs of clinical trials work. And while we can't always speak to someone's specific questions about an individual trial, we have quite a bit of information about what a person may expect with clinical trial costs. We can suggest questions to take back to their doctor or the research team. So we can help also if someone's looking for their different options with trials, and we can search for additional trials and help them wherever they may be with that.
That's great. What if there isn't a trial near me if I call in?
Sure, and that, yeah, sure, and that can happen where perhaps there's not an exact fit for someone who calls in. But we, again, will listen closely to the person's situation, and we can ask questions such as, you know, is travel possible? Is there a loved one in another location where the person would want to travel to and take part in a trial there? So I think, again, we will tailor that information, you know, and the search that we do. And we can tailor searches from 20 to 500 miles around someone's location to look for trials, or look nationwide. And we can also talk about additional options. If someone's looking to get a second opinion, we have a database of hospitals with cancer programs. So that can be another option too, is asking if that's something that the caller or the person is asking us about, and we can help with that too.
That's great.
So I think each information specialist, yeah, it is, and they take their time to just thoughtfully explore what people's options are.
And there are a lot of options, and that can be really confusing for people as they're starting to ask questions about whether a trial is right for them. I would like to point out to our viewers that if you would like to search on your own for an NCI-supported clinical trial, we encourage you to visit our website at trials.cancer.gov. And you'll find a simple search form there to get you started, and there'll also be links to resources on the website that can help you, and there's also a way to link right there to, of course, the NCI Contact Center if you'd like to enlist their help in finding a trial. Okay, let's take some additional questions about the Contact Center. Let's see. Here's one. I noticed there's a pop-up chat on the clinical trials search page. Are there real people who respond to the chat?
Yeah, yes, I think that's a great question, and we get that question when people connect with us, and there are real people that help answer those questions, and we know that clinical trials can be something that people have a lot of questions about, and so that pop-up can lead people, or does lead people, to our live help service, which is 9 a.m. to 9 p.m. Eastern Time. So there's an information specialist there who can answer people's questions about trials and any sort of topic about cancer, and they're glad to help with that. And again, it'll be tailored to that person's unique needs and situation, and it's the same service provided as someone who calls the contact center. So yes, please do click on that if you would like, and there'll be a real person waiting to talk with you.
And that's a medium that more and more people are looking for and comfortable in, so it's great that the contact center will do that. And is that also in Spanish, available in Spanish as well as English?
That is, yeah, yes, it's also available in Spanish, and I think, every person can decide which, way of contacting us is best for them. The one benefit of the live help service is that you do get answers. You can get links to information and answers in very quickly. So after calls, we can certainly follow that up with information as well. But on our live help service, some people like that because they'll have links right there.
Well, and in fact, why don't you, this next question we have here is, will the contact center email or mail me copies of any materials that might be helpful? What kinds of materials can I expect?
Sure. No, that's a great question. We certainly can send information. That's something that we do all day long, and we're glad to do that. And so oftentimes after a phone call ends, we will follow that up with an email to the person who contacts us, and we can send links to a wide variety of resources that we use. So information that I talked about earlier, like the financial assistance or support organizations, or more in-depth cancer information, we can send links after that conversation. And oftentimes I think people will then perhaps forward that information on to a loved one and share that information. It can be a handy way of communicating, during a stressful time when people are handling a lot of information. So we try to make it as tailored as possible. We can, tailor links to specific sections of information in our resources. So again, very, very, carefully tailored to what was discussed on the phone call. And then we can also follow up the live help chats that we have. We can send an email after that as well that contains that chat transcript. So if someone wants to look back, they can read that, and also click on the links shared there as well.
That's great, because it's hard to listen to all that information. It can be complex, and you may be feeling emotional, so it's great that there's follow-up, that you can get the transcript and have that to look over later.
Yes, I think that is a common feeling of people feeling overwhelmed, perhaps not knowing what questions to ask, not knowing where to look for information. And I think that's one thing that is a very important part of our service, is how thoroughly the information is examined to be accurate and to be up to date. And I think there's just so much information online, it can be very overwhelming for people, in addition to what they're learning at their doctor's office. So yeah, we're definitely glad to help with that.
Okay. All right, we've got another question here. What kind of clinical trial information do you find that most people ask for when they call about clinical trials? What are they asking about mostly?
Sure. Now, that's a good question. I think probably searching for trials is the most common question, people wanting to find a trial in their area. So I think getting that call either from a cancer patient directly or from a family member, that's probably the most common type of question we get. And I think some other questions can include, like I mentioned earlier, the medical professional who's maybe looking for a clinical trial. Sometimes there can be things in the news that people are curious about. Maybe they saw something, online or on a news program, and they want to know more information about that trial that is being discussed. And so we can certainly see what we can do to help with those questions as well.
All right, thank you. And we've got a question here about how long has the contact center operated, and this might speak to a little bit about the the lessons learned over the years and why the service is so strong today. How long has it been around?
Yes, no, I think that's a great question, and I think it does speak to all of those lessons learned, like you mentioned. I believe it's since 1975 that the information specialists have been here helping people with questions about cancer. So a very long time to learn, how to best help people.
Right, that's great. Let's see, what kind of online resources do you use to answer a tough question?
Sure. Well, we're fortunate that we have a lot of resources to use. So that can really assist, because you can imagine with cancer and all the different types of cancer, there's a lot of information to wade through. But we have a variety of resources that we use, not only from the NCI, but from other government websites. One example of that is medlineplus.gov, which is a service of the National Institutes of Health. We also use different guidelines for health professionals, such as NCCN and other resources.
What's NCCN?
Such as online medical. Oh, sure, I'm sorry. That's the National Comprehensive Cancer Network. So they provide guidelines to health professionals, and so we use that for the more in-depth questions that we get. So we have quite a bit that we can use to answer people's questions. And online textbooks, we also have that provided as well. And again, sometimes questions will lead us to having to dig a little bit deeper, and that's something that we are glad to do.
That's great, and that answer also, again, sort of underscores the comprehensiveness and the accuracy of the information that's available from the National Cancer Institute. Sometimes it can be really hard to know which sources of information to trust.
Yes.
Yeah.
Absolutely. Yes.
Another question here is, have the types of questions you receive changed over time? Have you noticed any changes in the kind of the trends in the questions?
Yes, I think they have changed over time. I think with the popularity of the internet and the amount of information that is out there for people to read, it again can be overwhelming, and it's more information that used to be readily accessible. So we've seen over the years that the complexity of questions has certainly increased. And I think along with that have built up the resources that we use here to help meet that complexity. So I think that's probably the biggest way that they have changed over time. And I think there could, go ahead, please.
Well, I was just going to say, so some of the people who are contacting you are coming to you with a little more of the homework that they've already done, and your information specialists, need to kind of be able to handle those.
Exactly, and they absolutely are. Yeah.
That's great. All right, we've got one last question here. Do you respond to direct messages from NCI's social media channels?
Oh yes, we certainly do. The NCI is very active on social media, and that can be a way where people can interact. Again, you can choose which way you want to ask questions, and so you can ask questions on the National Cancer Institute's Facebook page. There's a way to both publicly or privately message your questions. There's also Twitter and Instagram. So there's different ways to submit your questions on all of those channels. And again, that's something that's closely monitored, so we can get back to people as quickly as possible with those questions.
Okay, that's great. Well, that's all the time we have today for questions. I'd like to thank all of you for joining us during this latest Facebook Live event from the National Cancer Institute. As I mentioned, on Wednesday, November 29th at 1 p.m. Eastern Time, we'll host an event on the same topic in Spanish. Be sure to check NCI's Spanish Facebook page for updates about that. And Astrid, thanks again for sharing your story and your insights, and for all the great work that you and your staff do at the Contact Center.
Thank you so much for having me.
You bet.
U.S. Department of Health and Human Services, National Institutes of Health, National Cancer Institute, cancer.gov, 1-800-4-CANCER. Produced October 2017.